You can see the Health Secretary, Wes Streeting, has joined me. Time to talk to the government. A very good morning to you, Minister.
Good morning.
So much for joining us. Talk us through what you're announcing today. It's headline grabbing in terms of extra appointments.
Yeah, so building on some of the things we've already announced for GPs, including the recruitment of 1,500 more GPs onto the front line, which we achieved by the end of March. The £889 million we're investing in GP services through a new reformed contract. Today, we're dealing with the other thing that we've heard lots of complaints about from GPs and patients, which is the quality of GP facilities, GP practices. And what GPs have told us very clearly is that in order to meet patient demand, to get more appointments, they don't just need more GPs, they also need more space. So today we're announcing the upgrade of 1,000 GP practices across England over the next year. It's an investment of over £100 million. That means roughly 1 in 6 GP practices in our country will be upgraded, and it means that they'll be able to deliver up to 8 million extra appointments. So for people that will be on the phone at 8 o'clock this morning trying to get through, I suspect on busy lines after a bank holiday weekend, who will be frustrated because today there will still be lots of people who can't get through, all of these things taken together will start fixing the front door to the NHS in general practice and making sure that when people need a GP appointment, they can get one.
I'm interested you used the words there, up to 8 million extra appointments. Obviously, a kind of all-important qualifier to the number, because I was surprised reading the press release that upgrading 1 in 6 physical locations of GP practices can lead to 8 million extra appointments. That's a target rather than an expectation?
It's an estimate based on the projects we're doing and the expansion through things like new consultation rooms. So it's an estimate. It's a significant increase, but you know, GPs are delivering huge numbers of appointments every day. In fact, they're delivering 1 million more appointments now than they were before the pandemic, even though.
And you think that expanding the physical locations can now add 8 million? Yeah,
and because it's taken together with the other steps we're taking. So when I came into government, I found this absurd situation where patients couldn't get a GP appointment and GPs, qualified GPs, were unemployed. So we expanded an existing scheme that was actually targeted at people like your practice nurses and other staff. We expanded that so that I could put 1,500 more GPs onto the front line by the end of March, and helping to deal with GP unemployment and helping to deal with that absurd situation. Similarly, the £889 million we're investing in a reformed GP contract should improve both the quantity and quality of services available, making sure that by the autumn you've got things like online booking, online access to appointments, so that you can start booking GP appointments with the same ease and convenience we do other things in our lives. And today is the latest of the building blocks to reform general practice. Mm-hmm. Now, all of these things taken together, they don't just erase the last decade's NHS crisis overnight or in a year, but these are all the essential steps to doing what we said we would do, which was to rebuild general practice, bring back the family doctor and make sure that when people need a GP appointment, they can get one.
Just quick final question. So 1 million extra appointments so far, which is obviously impressive. 8 million extra appointments is by when?
Once we've got these practices built, we should be seeing up to 8 million more appointments. That'll be a significant increase in GP capacity.
This year?
As I say, it's an estimate. Well, obviously it takes time to build
the estate, but
over the course of the next year or two, I would hope to see a significant increase in those GP appointments.
So I'll play this clip back to you in the next year or two. You've done 1 million in the first year. You're going to do another 7 million.
Yeah, look, absolutely. And look, I know I'm going to be judged on results. And so far, the results are encouraging. We've got waiting lists down for the last 6 months. The 2 million more appointments we promised in the first year of a Labour government to cut waiting lists for treatment, we actually delivered that 7 months early. We're on over 3 million. But one thing I just want to reassure your viewers about, because I think this is a point at which people start shouting at the telly and saying, hang on a minute, I'm still on a waiting list, or I couldn't get through to my GP last week. We know that unless and until people feel those improvements, people will want us to go further and faster, and that's what the Prime Minister's told us to do, putting our foot down on the accelerator. All I'd reassure people is that change has begun, the best is still to come.
On the topic of what people feel, obviously the local election results weren't as you would have hoped them. The big talk over the weekend has been whether or not the winter fuel payments cut was a mistake or not. I just wonder what your view was on that originally. Were you for it or against it or neutral on it?
Well, like the rest of the government, I supported it. And what I'd say to people who disagreed with this decision, employers' NICs that went up, the decisions we've taken on non-DOMs, the tax breaks for private schools. All of these measures are ones that have enabled us to put £26 billion into the National Health Service this year, to invest in more teachers in our state schools, breakfast clubs. We've got a lot to deal with as a government. I don't think, even if people disagree with some of the individual decisions we've taken, I don't think anyone would disagree that when you look at the breadth and depth of the crises in our country, the state of our NHS, our schools, lack of police on the streets, lack of border security, the prison overcrowding. I mean, on every single front, we're dealing with a lot. And so the Chancellor had to do a lot of heavy lifting to get the country out of the hole it was left in. And while these measures, I think every single one of them opposed by other parties, I mean, they're also opposing the investment in the NHS. They're also opposing the investment in our schools.
The NICS increase raised £25 billion. The winter fuel payment cut saved only £2 billion, and it had been going to 11 million elderly people. I guess the additional thing that we now know is it came at a great political cost as well. Is it worth re-looking at things in light of that cost-benefit analysis of the particular decision?
Well, I wouldn't be close to those sorts of discussions at this stage ahead of spending review and budget later this year as well. But what I do want to reassure people is that in terms of last Thursday's local election results, we have noticed, we have got the message, and I think what voters are telling us is that unless they see the change that was promised delivered, unless they feel the change in their lives, they will look for change elsewhere. And that's why the Prime Minister's pushing all of us in government to go further and faster at delivering the results that the country want. That's why what we're doing on the NHS is so important. It's one of the top issues facing the government. But beyond the announcements we're making today about GPs and the progress we're making on waiting lists, you look at some of the other issues. On cost of living, for example, I froze prescription charges because I recognise cost of living as an issue. On border security, Yvette Cooper's deported 24,000 people since she became Home Secretary, which is a big increase on previous years, and there's an immigration white paper still to come. So on those priorities of the public, the government is taking action. A lot done, so much more to do, of course, but we're putting our foot down on the accelerator.
It's clear the winter fuel payment was a priority for the people as well. Just to come back to that, I mean, there was also talk of, in fact, rather than reversing the decision, tweaking it and increasing the threshold over which pensioners no longer get it, from £11,500 to something higher. Would that be a sensible rationalisation of where we are at the moment?
Well, I'm not aware of those discussions if they're taking place. I mean, these are the sorts of decisions that are taken collectively, so I'm not going to speculate, however much you invite me to, on some of the speculation in today's newspapers.
I guess, you know, you're saying further and faster. Your department, it might be quite clear what that means. Is it also reasonable to look at the decisions that have been made and consider whether any of them were a mistake and to, if necessary, come up and be upfront about that?
Look, we're always listening and we're always looking at how the policies that we're enacting, how they make a difference. I dare say over the coming years there will be bumps in the road. We're going to make mistakes. That's just the nature of life, let alone politics. I think the thing that we are all conscious of in government and actually genuinely impatient for is to make sure people are feeling the change. And we've only been in, 9 months now, less than a year. And it means that some of the change that's already started, people won't necessarily be feeling it yet. So if the Chancellor was sat here, she'd say, look, interest rates have come down 3 times on my watch. Wages are finally going up faster than inflation, not least thanks to the 3 million lowest paid workers receiving a big minimum wage increase thanks to this government. But that doesn't wash away a cost of living crisis that's been years in the making. So not everyone will be feeling those benefits yet. Similarly, on the NHS, if you're one of the people who has now been seen, you'll be really pleased. You'll be off the waiting list. If you're one of the 7 million cases on the waiting list today, me saying waiting lists are falling is not doing much for you right now. And that's why we've got to go further and faster. And similarly on the work the Home Secretary's been doing on deportations, big increase on previous years, and I don't think she gets nearly enough credit for that. But she also knows that there's much more to do on deportations. She also wants to deal with problems at source, which is why, whether it's our near neighbours in France or further afield in Iraq, she's been meeting with counterparts internationally to deal with the problems at root cause. We're in no doubt that the country wants to see change. They want to feel change. It does take time. Change has begun. The best is still to come.
Obviously, small boat crossings are up at a record level for this point in the year. Just rounding things off, President Trump announced a new tariff over the weekend. It was an industry-specific tariff, 100% on foreign films, as opposed to country-specific. But it feels very pointedly aimed at a country like the UK, where we do offer tax breaks for that sort of industry. Is it time to sort of give up on these hopeful negotiations?
Well, we're not seeing the detail of some of these reports, and so I'm not going to provide a running commentary on that specific measure. But we're not giving up on trade talks with the United States. They're an important trading partner. We want to see progress made to reduce tariffs and to boost British businesses,
Losing
British
patience,
jobs,
though?
British growth. But we're also looking with our near neighbours and biggest trading partner in the European Union. We're also looking at striking trade deals further afield. So the number one priority for this government is getting growth back into the economy, because if we do that, everything else becomes so much easier. You have more headroom in the budget to invest in public services or put money back in people's pockets through tax cuts. One of the reasons why we've got a high tax economy is because under the Conservatives for so many years we've had a low growth, low productivity economy, and that's why they ended up putting up taxes to the extent they did. We want to reverse that trend. That does mean getting growth back into the economy, and that does mean making the most of Britain's potential as a global trading nation, and that's what we're working to achieve with the United States and others.
Health Secretary, good to see you this morning. Thanks so much for stopping by. Wes Streeting there.